Hey you guys, so it's finally here. I know you guys have been asking me for over a decade now to create a kind of mentoring program for you guys. So I used to teach the postdoctoral diplomate program years ago, but it was really kind of burdensome and just too much information for everybody to really be able to apply. So this time we're going to do things differently. So I've spent the last, say, 15, 20 years retooling and kind of redefining and creating what I like to call the radical art of simplicity. So a program that anybody can step into, anybody can mimic, and anybody can be successful with it. So I want to do a 12-month program with you. I want to teach you the unique approaches to functional lifestyle medicine or functional medicine, but in ways that are more meaningful for you, ways that are inexpensive and simple for the patients or clients. So I have about an 95 to 100% success rate over the last 20 years, except for 20-year-old boys, so the worst patients. Don't invite them into your program. But otherwise, I mean, this has been really successful. And I've had clients from all around the world, and I end up being the doctor that doctors go to when they can't figure out themselves. And finally, we have a way to share this so you can replicate me into your practice. So this course, I got my little notebook here of information for you. So we're going to cover a multitude of coursework. So basically going from normal physiology to pathophysiology to restorative or functional lifestyle medicine restoration, and then really deal with a bunch of case studies of how we apply this and then how you apply it to the next new patient, right? So we don't want to just learn stuff. We want to learn how to apply this information to every single patient. And then you have the easiest job in the world. Like, I love the fact that I had, bounced around the world, all these beaches, and, seeing clients from little bungalows in the jungle and, on the international train from Austria to Milan, you're in there helping clients out, right? So we don't do patients outside of our licensure, but we do functional lifestyle medicine, kind of telehealth that's outside of that scope. So that allows us the freedom to travel and have adventures and still help people in the process. So we just change things around, which we'll talk about during the coursework, how to implement this better. So that way you aren't getting in trouble and you're still helping people. So once we kind of know how the body works, know what we do to mess it up, and then teach people to stop messing it up, that's the simplest, cheapest, easiest way to really reverse the most chronic conditions. So you will become an expert at like reversing Crohn's and ulcerative colitis and eczema, psoriasis, asthma, allergies, all these things that they tell you are incurable. You will just kind of smile when patients come in or clients and be like, yeah, we're going to change your world. And we're going to do it in like 6 weeks to 6 months. Usually about 6 to 8 weeks is all it really takes for the most profound effect changes. Make it to where people don't need medication intervention, and also making it so they don't have to have constant supplement intervention. Because again, one of the biggest problems within functional medicine is pricing out your own care. So we love the zebras, we love the unique things, we want to like sell gimmicks and complicated processes all day. But the reality is simplicity is what really cures people. Simplicity is what fixes the most complex problems. And so I want to give you that confidence that when that Crohn's patient comes in and they're like, I've had Crohn's for 25 years, I'm maxed out on medications, and you can just be like, yeah, that's not going to be a problem. So I love what I do. And I want you to love this process too. So we're going to, talk about how the physiology works. So that way, even, if you're a nurse or a doctor or even just kind of around healthcare, you should still be able to understand this enough to apply it to clients and patients with ease. And then, of course, we'll be there to mentor you through the process. I'm going to help you develop a consult that works. Now, it is rare that people come in and they are not sold after we get done with the consult. So we kind of explain why they have what they have, which no one else has done, and then create a report of findings. And we do a tiered program that, with clients and patients that, again, I want to teach you that, how to create your own, and give you all the tools that you need for that. So really where it's your focus within that whole report of findings. So we all want to cover the same bases, but we kind of want that little uniqueness that makes us different. Although you could just copy my stuff and do the same thing. And then teaching you how to do reevaluations. And these are critical because patients will come in for one thing, right? Our clients, just use them interchangeably there. But when they come in, they usually have one or two things they can't stand anymore. But once we get through this comprehensive intake that we'll deal with and create, they have 30 to 60 things on average, often 60 to 90 things that they just constantly deal with all the time. But because it's constant, it just becomes their normal. So we don't want to know the one thing. We want to know the whole clinical picture. We want to be able to go through every single thing they have on the reevaluation and make sure almost all of that stuff is just gone. And it's amazingly simple to make the most complex patients just go from this many problems to that many problems. So all you do is create normal, don't do gimmicks and nonsense, and then you look like a hero to these people. So topics, we're going to cover some big ones. We'll cover some other ones in between this too. But when you look at like thyroid, we'll cover thyroid, teach you how to draw out the thyroid metabolism. So that way you can explain to clients why they have what they have, how it functions normally, and what we do to mess it up. So we'll cover hyper, hypo, autoimmune thyroid. With gastroenterology, of course, the IBS, the Crohn's, ulcerative colitis, the chronic diarrhea, chronic constipation, those are so easy to deal with, and we'll teach you all about that. Endocrinology, type 2, type 3, and the new type 4 diabetes that we're starting to see. Even, is it possible to reverse type 1 diabetes? So we'll deal with autoimmune throughout this whole thing. Autoimmune is all the same thing. It's T-cell dysregulation, molecular mimicry, and we will talk about that in depth of how to reverse the most complicated things through that T-cell dysregulation and secondary molecular mimicry that leads to autoimmune conditions. And we'll make it to where it's easy, like it just rolls off your tongue, like how you synthesize a methylated alkaloid. Great. Sounds great. It's actually super easy. So then with hormone balancing, if you don't know, if you give people hormones or antidepressants, you downregulate their own production. So we're going to teach you a whole different method here. And this is one of the things I learned when I was or touched upon a little bit, when I was the keynote speaker in Thailand at the International Symposium on Health and Wellness there. So we don't want to cause problems to fix problems. We want to teach patients how their hormones are developed, how we mess them up as Americans, and to teach them to stop messing them up. So we're going to cover how to balance your hormones without hormones. So even if they have lost their ovaries and uterus, you will be confident as can be of how to actually normalize their hormones. And then with cardiology, I mean, and again, that covers anxiety, depression, which are so easy to fix. Just astronomical to easily to fix. And then cardio, so cardiophysiology, I mean, we're going to talk about how the heart works, how the blood vessels repair, and then really concepts like hypertension, heart attack, stroke, and then really focusing on the cholesterol myth and the cholesterol paradox, and how cholesterol actually makes your hormones. You don't want to mess with those. It actually makes vitamin D too. So we'll talk about all that stuff. But with cardiovascular, it's a constant damage repair situation. And so when you have more damage and less repair, that's when you have sustainable cardiophysiology or cardiopathology problems here. So we're going to talk about all that too. That's a huge one. That's one out of two Americans. Then, of course, weight management. And weight management is really like super easy if you don't do gimmicks, right? So Tufts University said that every major diet program in the United States fails. So they never treat why. So what we're going to do to create sustainable, meaningful weight loss is teach the clients why they have what they have, how it's supposed to work, and what we're going to do to make those changes and make sure they hit those markers. And then there's tweaks along the way that we'll do, but again, no gimmicks, no nonsenses, none of that stuff for them, because everybody that loses weight with gimmicks, according to Tufts University, will gain that much weight that they lost, plus 50% more within 6 months. So we don't want to be a part of the problem here. We want to radically think differently about this and apply simplicities. And then one of my favorite subjects, and so, I've postdoc from Harvard, postdoctoral education for Harvard in lifestyle medicine, also from Yale, and bioengineering from Yale open course. And then I also took a bunch of coursework through University of Melbourne School of Medicine. They had an epigenetic program back in the day. And this is really incredible because we've actually been able to reverse some fatal genetic mutations. And so it's through simplicity. Again, just like anything, you have your ability to constantly repair DNA and the damage that goes to that DNA. So the minute that we surpass the ability to reverse mutations and cause less, then when they retest, they should have normal XY karyotypes. And we'll go through and really simplify that. It used to be hard when I first started doing that, going through 20 to 25,000 genes and 200 to 300 mutations. And how do you make this a meaningful presentation to clients and patients? But we've worked through those details and we'll make it easier for you. So with epigenetics, the ability to kind of reverse DNA mutations, we'll talk about how to interpret it, what it really means, what it doesn't mean. When you look at things like methyl tetrahydrofolate reductase mutations, oh my gosh, talk about gimmicks. Like, this is very frustrating for me. I actually have an NIH grant because I'm NIH certified to do research and get grants from them. But at KU Medical School, we have a research program where we're looking at hard to treat patients with the methyl tetrahydrofolate reductase mutation. So it's not always what we think it means, and we're going to deal with the simplicity of that. So what are we going to do? So we're going to have a couple live courses like Tuesday, Thursdays, where we actually will set our little time back and we'll kind of teach these processes, how to draw these pathways, so that way you can draw them for clients and patients so they know you know what the hell you're doing. Even all my doctor patients, like, I'm the guy that doctors go see when they can't figure themselves out. And they're often surprised about that simplicity of the metabolic pathways that we cover and how we fix them. So it's 1 to 2 times a week, and it's self-paced physiology also. So we'll do some like live Zooms with each other as a group for certain things. And then maybe individually for some things that you need help with. But also we'll have like some physiology coursework for each of the things that's a little bit more comprehensive than what we're going to talk about. But you can do those self-paced. So I'll come up with the material for you to go through and we'll take care of that. And then with some of the stuff you're doing, especially as we're trying to really teach you these concepts of like having a very effective consult and report of findings, and I want you to be able to present those back to the class. So we're going to have you guys record your own report of findings and go through it as if there's a client or patient there. So that way you really have this down. And over the course of the year, you're going to try to implement these things, and it's going to be uncomfortable until it becomes comfortable. But the whole purpose of this is by the time you get done, this flows out of you. Like, you don't have to really second guess yourself. The first probably 10 years of what I was doing was like, I hope this works. Now the second 10 years is like, Yeah, it always works. So once you have all those layers of success under your belt, that becomes your really validity and confidence. In the beginning, it's just I'm your validity and I'm your confidence in the beginning, to where you just kind of parrot and mimic what I've done, and you tell those stories to the clients and patients, and then you get your own success that you can parrot back to them. So that way, man, as you go through this, I wish there was something like this when I was going through. All my mentors were always like, hey, can you teach me what you're doing? I'm like, no, you're supposed to teach me something. But what I found was most people really just sold complication. And complication becomes frustrating, it becomes very expensive, and eventually people don't really succeed very long in functional medicine because of that. So there's a lot of half-ass courses out there. There's a lot of courses where they want a bunch of your money and never really deliver anything that's meaningful. But this is why, this is the legacy that I want to create. So now once you get done with this, right, so you, through the boards, you can get, and you'll get certifications along the way. So as you prove that you are proficient and competent in each of these courses, then you get a certification to hang up from that. So you'll have those certifications, which are great. It helps give you some of the validity as you go through this. Much of the coursework I did at Harvard and Yale and stuff, they don't offer that stuff anymore. Those are fantastic because they were like, here's how you reverse Crohn's, eczema, psoriasis, allergies. But they don't teach that anymore. So now I got to teach these things to you. But when you get done, you'll actually have meaningful qualifications. And that's one of the things with health coaches, there really isn't much of anything to kind of like give you that instability. So having the backing of the American Board of Nutrition, the American Board of Functional Medicine is going to be very meaningful for this. So that way you don't have to try to convince people that you know what the hell you're talking about. They know. I mean, my office used to be 4 or 5 plaques, and then it became the whole room was plaques, and then it became layers of plaques. And so I probably have, I don't know, 30, 40, 50 certificates and postdoc stuff that used to hang on my wall, but I took it all down a long time ago, but I'm probably going to put it back up. It looks good. It looks good. So once you get a few of those, nobody asks you qualifying questions like, can you help me? Or what makes you think you can help me? They just look at your wall and go, okay, all right, you just tell me what to do, you know? All that people care about is, can you help me? How long will it take? And how much does it cost? That's it. That's it. So you get diplomates, dual diplomates if you want, certifications from those boards, certifications from the coursework, and then you also will have the ability, if you would like to, actually practice through the Genomic Wellness Group. So that's a telehealth organization that we created. You can treat clients from anywhere. Everything's already built out for you. You just become one of the new practitioners, and then we kind of market, and then you market too, and then you actually have a forum for this. So you don't have to create your own website and do all your stuff. Plus, we have an international board of advisors from all over the world. And then we also have mentorships through there too, which is great. So I think that might be it. So basically, I have the dates built out. I'll put that online. You know, we have things like where you create your consult, then present your consult, create your food as medicine protocol, then present that. All through this to where you can actually feel competent at the very end. And then with immune system, we'll also add in the molecular mimicry stuff to reverse autoimmune stuff, food sensitivities, but differently than you've probably ever been taught before. Of course, resiliency and neuroplasticity, emotional IQ, all those kind of things. I think that's it. And then we're going to go through case studies too. So you'll have extra credit stuff, or just on the side things of like, okay, now you have a patient with type 1 diabetes, how are you going to approach that? Patient with type 2 diabetes, how are you going to approach that? So at Harvard, they offered that same kind of mechanism for us. And oh my gosh, I loved how they presented stuff. At Harvard, it was really cool because you were never really wrong. It was just like the author, or the mentoring physicians, like, this is not how I would do it, but I would be more likely to do C, and here's why, right? So part of the process of always learning and really finding your, or fine tuning and kind of developing your excellence is kind of going through that. I mean, I remember back when I've done 3,500 hours of medical rounds, and I pretty easy. Nobody really gave me much crap, but oh my gosh, internal medicine. Oh, I got ripped a new one once, just once. And he asked me all these questions and I just blew it. And then by the time I got back to the office after rounds at the hospital, I was just like, I can answer every single thing that he asked to qualify and quantify how that patient was doing in ICU. So it's good to mess up. It's good to make mistakes. That's how we learn this stuff. And it's better to do it through the program and through the case studies than kind of choking in front of clients and patients. Although it's always fine. You always just say, you know what, that's a great question. I'm going to look that up, and I'm going to ask my mentor about it, and we're going to figure this out for you. All they care about is if you can help. You don't have to know everything, which is good. So even some of you guys that are like, I mean, nurses are going to be fine, the nurse practitioners are going to be fine, the chiropractors, the medical doctors are probably going to be fine. But we have a few people, I'm sure, that are going to be really overt medical, but they'll figure it out too. I mean, I built a house from scratch. I just watched YouTube videos and had my little mentors online on how to rewire a house and how to rewire a square D fuse box, and just kind of work through that. Didn't die yet, so pretty good. All right, well, the website is mentoringfunctionalmedicine.com, and please share this with everybody. I mean, this is, we're not in competition. We all need to win together. And when 3 out of 4 people are chronically managing chronic diseases, and the average person has 20 to 30 to 40, 50, 60 different problems, there is no shortage, okay? So make sure you share this. If you guys do this as groups, like I know several of our practitioners, they want to kind of like couple up with another doctor they know really well and go through it together. That's way better because you're constantly interacting with each other. So the cost structure for this is on the website. The return on investments is on the website. Like, I mean, this should be able to go from knowing nothing to kicking ass in 12 months or less to where you really feel confident. And then you'll tease out that and get more and more confident as you go. So I hope you guys are happy. Like, this is what it's all about, all those years of people asking me to create this. Now I created it. Now let's get to it and start kicking ass and helping more people. So love you guys. Please check out the website and let me know if you have any questions, and the phone number's on there for that program. And please share it with others. All right. Bye, you guys.